Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Aimee.
She's known as the Egg Whisperer.
Fertility expert Dr. Aimee today.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Welcome to another episode of the Egg Whisperer Show. We're on once a week, starting at 5 p.m. I'm a fertility doctor, and tonight's show is called Fertility Shots. I want to give you an insider's tips to how to give the best shot. I'm not a bartender, I'm not a mixologist, I'm a fertility doctor. I went to school a heck of a long time to figure out an egg and sperm make a baby. And yes, I've probably given over 10,000 shots over almost 10 years. So I think if there's anyone that knows how to give a good shot, it's going to be me. So stay tuned. I might even give myself the shots to demonstrate throughout the show. So just a little bit about me. My last name is quite complicated. People call me Aimee, Dr. Aimee, the Egg Whisperer, or Dr. Avazadeh, like my dad. My dad's Dr. Avazadeh, a vase of flowers a day. Everywhere I go, people say, how do you pronounce your name? And I say, Dr. Avazadeh. But don't call me that. Call me Aimee. So if you want to call in tonight, we'll put up the phone number for you to call in live and ask me your fertility question. You can also email in advance. So if there's a question you want to ask in the future, you can definitely do that. I think everyone's awake. I think you're all awake because I said I'm going to put the shot in my tummy or my tushy. Yes, I might show you my tushy, but I'm going to avoid the area of my tattoo. I don't have a tattoo. Maybe I do. So watch through the show and I'll hopefully make it fun as you learn about how to give yourself fertility shots. Because I think that fertility shots are one of the things that many people avoid fertility treatment because they have such a phobia of needles. So in the news recently, and it was actually recently today, it was on Good Morning America and on Healthline, was a recent update on research about fertility decline in the US. I'm not an alarmist. There might be an epidemic if you were to read the recent news articles, but the truth is that younger people who are the most fertile are choosing to have kids less, and older people are having more kids. So that's not a surprise to me here in the Bay Area where my average patient is 39 and the average age of first birth is around 32 or 33. So what that tells me is that more people may have one child per family when they really wanted more than one, if let's say they start with number 1 at 39 and try for number 2 at 42, unless they did a fertility preservation procedure. So I think the message is out. I'm seeing so many young people in their late 20s, early 30s who are planning their future family, being proactive about procreation, getting their fertility levels checked, getting embryos frozen for their future family so that they have options. So this is the Good Morning America link. We're going to post it up there too if you want to watch it. But we have a TV on in my office and I said, oh, that's really great because I was interviewed for the article that they talked about on Good Morning America this morning. So the other thing that I get often from a lot of people are articles that people see online. And so I had many patients emailing me and tagging me in articles about the decline in sperm in men in the US and in other developed countries. And they're blaming it on, what did they blame it on? Man-made chemicals. And so I immediately thought, well, there are two man-made chemicals that I can think of, and that's pizza and beer. Pizza and beer, people. Yes, our lifestyle. So for the first time ever, being overnourished is actually more common than being undernourished. And that's actually quite an epidemic. So it's no surprise to me that we're seeing a decline in sperm counts because a guy's sperm is a picture or a window into his health. So make sure to put your sperm through a fitness challenge before you try and get pregnant. It's not just about having sperm, it's also about having healthy sperm to have a healthy pregnancy. And it's a heck of a lot easier to freeze sperm than freeze eggs. Guys just have to do it in a cup, not so hot, not so sexy or romantic. Neither is egg freezing, but egg freezing involves a surgery. Talking about surgery, another article that I was interviewed for Glamour magazine, published this week, was on ovarian tissue freezing. And all the headlines were saying millennials are going to be freezing their ovaries rather than egg freezing. And I said to myself, I want my ovary frozen. Wouldn't that be great? I'm 41 years old, take an ovary out, put it back in when I'm 50, and then I'll never have menopause. But then I looked at the details of the study. The ovary, once it's put back, maybe lasts 2 years, up to 5, and it involves surgery. Surgery to take it out, surgery to put it back in. And sometimes it takes multiple surgeries to get the tissue regrafted so that you can get pregnant or have hormone production resume. So we're not there yet, but I'm really looking forward to a technology that we can use to help women preserve their fertility that maybe won't involve fertility shots, a surgery, maybe one day. And I hope that day comes sooner than later. And then I came across this Instagram post from a doctor in Australia. And I said, wow, this is kind of huge. I can't believe that I didn't even know this, because I'm always thinking of how can I communicate and make fertility issues relatable to everybody. And everyone knows Marilyn Monroe, right? Like, who doesn't know who she was in US history? And what I found intriguing about her is what I learned about her fertility struggles. She wanted to be a mom. She suffered from a miscarriage, an ectopic pregnancy, and reportedly severe endometriosis. And there's even a story where she went to a theater production and put a sign on her tummy because she was having so much pain saying, please don't take my ovaries. So that just made me feel bad, and it just made me think that all that she suffered from related to addiction and pain meds was related to severe endometriosis in the end. So watch the Egg Whisperer show. We want to get ahead of infertility. We want to diagnose endometriosis early. And just for fun and for giggles, yes, I was interviewed for this story too. I get all sorts of interview requests, and this might have been the funniest. They asked me, what kinds of things do your patients get stuck up their butts? It's never not funny. It's always funny, even when you're an adult, to hear the word butt. It kind of makes everybody chuckle. If I had a laugh track on this Egg Whisperer show, it would be going off the charts with everybody laughing. But yes. So I was quoted as saying my patients lose things in their butts. They actually don't. No, they don't. But if you're a doctor, if your husband's an ER doctor, if your sister's an anesthesiologist, if your uncle's a colorectal surgeon, your cousin's a colorectal surgeon, you can imagine there's quite a lot of dinner time conversation surrounding what people lose in their butts. So I thought this was just a fun topic before we get really serious and talking about fertility shots. But before we get there, I want to bring up another recent article on autism in men. It's kind of along the same lines of fertility, sperm counts going down as men get older, and perhaps autism rates go up. So again, that's not a surprise to us, but I think that we're learning more and more about epigenetics and lifestyle, and how a man's lifestyle can negatively or positively influence their sperm quality. And if you look at some of the studies, what they show is that men with a BMI, body mass index, over 30, when they produce a pregnancy, might have a higher risk of a child with autism. So we all want to do everything possible to have the best vacation ever, right? When you go on vacation, you do planning. You look at tour books. You call your friends. Well, the same thing should be done with pregnancy. Get into the best shape of your life. Meet with an OBGYN, a fertility doctor, do preconception labs, get tested so that you can be sure that you're giving yourself the best chance for a healthy pregnancy. So now I just want to take a second and relax. Oh, I should drink from my fancy cup, Dr. Aimee at your cervix. I don't know if you could see that. I'll put up the email address if you want a cup for your own fertility doctor in the future. Let me just take some water here because I have to get ready to give myself some shots and I don't want to pass out. Okay, so every single person who does shots in my world is Wonder Woman, okay? So whenever you're doing shots, I just always want you to be stress-free, not feeling anxious, easier said than done. I mean, I've heard stories where husbands say that they have chased their wives around the house for 2 hours before they've done a shot. No joke, 2 hours. I mean, I just imagine him chasing her with the needle, her ducking behind the bed, and then running into the closet and hiding, and then playing like hide and seek until finally she gives up and he's able to give her the shot for the night. True stories. So remember to always have your happy place whenever you're in a stressful situation, whether it's drawing blood or anything. Picture it, relive it, make sure you know the landscape from top to bottom. Okay, so now fertility shots, but not those kinds of shots. So this is the list of shots we're going to go through tonight. Okay, you can see the list on the screen, and I'm going to start with Menopur first. So I have all the boxes right here, and then we'll show links. And the links that you'll see are really helpful videos. I'm just going to take everything out. So a lot of my patients do Menopur, and Menopur is FSH and LH, and they'll do a dose between 2 and 4 vials a night. So when you do Menopur, and I say something like, you're going to do 4 vials a night, and please note my really cool table. I'll show you what it really is with my logo on top, a gift from a patient of mine. When you do multiple vials, it's very easy to put the shot all in one syringe. So I'm just going to show you that very systematically. So the way Menopur comes, it comes in a powder vial. These are just for teaching purposes. So they don't have the powder inside, but the powder can look like a little rock or a pebble, or it can actually be in powder form. So if it has already formed a rock, like a rock, that can sometimes confuse people, and they get scared that maybe their medication isn't good or something has gone wrong, but that's often how it comes. So don't worry about that. So I really love the Q cap, and I'm just going to show you how to use it. So this is the Q cap. You're just going to pop off the cap from your water vial, and you're going to stick your Q cap in just like this. Voila, super easy. And then I'll just show you how to take a needle off. So I like to hold the syringe with my non-dominant hand and twist it off with my dominant. So remember, lefty-loosey, righty-tighty. So to take off the needle, you just go lefty-loosey, take the needle off, and set it aside in your sharps container. And then you just put these two together. It's super easy. Okay? So now what you'll do, you'll take a look at the numbers on the syringe. Make sure they're facing you. And I ask my patients to drop 1 milliliter of water, and you'll notice that there's a little bit of air at the top of the syringe. So I'll just push the air in, bring it back out, push it in, bring it out, push it in, bring it out. Just kidding, I'll stop that. Until all the air is gone. You'll notice that if you let go of the end of the syringe, the fluid is just going to go right up into the vial. So you'll pull down on the syringe again and just hold it there. See how I hold it? Just like that. And then peel the banana. Just kind of pop off the cap, the vial from the Q cap like that. Once that's done, if you let go, the syringe isn't going to go anywhere. So don't worry about putting it down. If you need to regroup, figure out what you're doing, no big deal. So now I'm done with the water. I'll now take the caps off the powder vials. And it's really important to stabilize things on a flat surface. I see patients that do all this kind of stuff, and I'm like, don't do that. Just put your vial down, hold your syringe like a pencil, and just push it right into the top. And then you're going to push the water in and do a little swirly swirly. As soon as the water hits the powder, it dissolves, literally just like that. Then you'll pull it. Yeah.
We have a question.
Yeah.
Is 1 milliliter the same as 1 cc?
Yes, it is. 1 ml, 1 cc. Yep, it is. And I use the word water, normal saline, water, normal saline. On the vial, it'll say NaCl. So when you see that, you don't want to get confused either. It's all the same. So now I'm just going to pay attention to draw up all the water. And I sometimes like to leave a little air inside the syringe just so I know that I've gotten everything back up. Okay? So now I'm going to peel the banana again, go to the second vial, push the water in, do a little swirly swirly, turn it upside down, pull all the water out. And now, since this is my last vial, if you were to have done 4 vials, then you would just keep going, 3 and 4. So this is my last vial, so now I'm just going to take the whole unit off, the Q cap, with the vial attached, set it aside. And not that I'm going to demonstrate this literally, but if you just throw this on the table, nothing is going to happen. So if I just take this, put it down, no big deal. So now I'm going to go find my injecting needle. This is my injecting needle. For patients that I like, and I like all my patients, but if I don't like you, you'll know it because I'm going to give you the long needle. Just kidding. We use this size needle, okay? So at this point, you're going to push the air in. And if you forget to push the air out, I should say push the air out of the syringe, don't worry. Putting air in the skin of your tummy isn't going to hurt. So now your needle is ready. And one of the things that people get confused about is the following. They say, Aimee, I started with 1 ml and I have a little bit less than 1 ml left. What happened to all my drugs? And what I tell them is that the volume of fluid has nothing to do with the strength or concentration of the medication. The medication says 75 IUs per vial. There's actually a little over 82 IUs as far as the LH and FSH that's in there. So that when you travel down the vials, you don't have to worry about losing medication. It's set up that way so you don't. So you're still going to get 75 of what you need per vial. So now to give yourself the shot. Here's my stomach. Not quite the six-pack abs that I was hoping for. So as far as where you go, you want to go below the belly button, only because you have less sensory nerves below the belly button. It's going to hurt a lot more if you go other places. Patients have asked me before, can I go my inner thigh? You could, but that would hurt more. So I prefer the belly, okay? So let's just say this is my belly. You're just going to take an alcohol swab, and people are very clean around here. And what I mean by that is people tend to over clean. So it's like clean, 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 clean. Don't do that. Just do one swab, let it dry, and then you can pinch. So pinch, you're going to line up the needle just like a dart. And yes, I have had a partner tell me that he threw the needle like a dart at his partner and it didn't go in and was wondering why. True story. So then you're going to push the end of the syringe all the way in. That didn't hurt. Not at all. Okay, and then you're going to come out. And because it's a really tiny needle, what that means is that you can only go as fast as you can go. So if you go super, super fast, sorry Paula, didn't mean to get you wet over there. In my office, my desk is very fertile and so is my rug from doing that over and over. So sometimes if you put too much pressure on the end of the syringe, it can pop the needle off. I've seen that before. I've done that before. The other thing that can happen is that if your needle is not screwed on tight, make sure it is. If it's off kilter or not on quite tight enough, you can lose medication from right there. And every drop is like $15, so make sure to lick it. No, don't do that. Don't lick it. But seriously, like, take your time. If you're a patient of mine, you can always FaceTime me and I'll take you through the steps. This is probably the only YouTube video I'd want my patients to go to as far as tips for fertility shots. But if you ever have a question, take a time out. There's really nothing that you could potentially do that could really screw up a shot. So just know that. There's always a way around anything that you might have done that weren't according to the instructions that you were given. But at the end of the day, talk to your fertility doctor and make sure that you're doing things the way they want you to. Okay, so next shot is the gonalf pen. This pen is very cool. So gonalf has FSH hormone in it, okay? So you can see that the medication is actually loaded right here. And then on the side are the dosages. So when your doctor assigns you a dose, all you do is look at this little window here. It has a little number, and you're just going to rotate it away from yourself. And then the thing is, if you screw up, look what I'm doing, no big deal. So let's say the dose is 300, and you actually rolled up to 312.5, no big deal, just bring it down to 300, okay? And then it isn't until when you push this end down that the medication actually comes out. So I'm just going to attach a needle. So I like to put needles on with my dominant hand. So you can see that there's a little place for the needle to go in, and there's a needle right there. So you're just going to push and give it a few screws. I said screws, huh? And then you're going to take one cap off and the second cap off. And then watch out, Paula, I'm going to get you. Just kidding. So, well, maybe I'm not kidding. But this is my sharps container, so I'm just going to spray it into my sharps container right now. So that's just 300 units right there. Once it goes into your skin, you're just going to release and come out. Okay? So that is the gonalf pen that I just showed you. So tricks with the pen. What you should know. Not so much a trick, but it does come refrigerated, so make sure to just throw it in the fridge. Menopur doesn't. It just doesn't need to get super hot. So if it's around 77 degrees or less, you're cool with the Menopur. I tell patients to put their Menopur in a kitchen cabinet or a bathroom cabinet. As far as the gonalf pen though, this does go in the refrigerator. What you'll also notice is that depending on the dose of the pen that you have, let's say it says 900, it actually has a little bit more than 900 units. And there is a way of getting the extra out, and I'm going to show you that when I go to the Follistim cartridges in a moment. So I'll just set this aside. So that's gonal. And then the next medication we're going to talk about is the gonalf multidose kit. So this multidose kit is also FSH hormone. It's just in a different way. This is just a demonstration package. And on the kit, it says multidose 1050 IUs. So it says 1050, but it actually has more. So I always like to underorder versus overorder. I want patients to save money. I don't want anyone to have $2,000 worth of medication at home that they haven't used. I really just like to order the amount that I think that they'll need, and then we can always order more. If a patient needs more, if we need to go up on the dose, I'd rather order less and then put in an extra refill. So it comes in a tray like this, and I think one of the things people forget is that these are actually the needles that you use to draw up to give yourself the actual dose, okay? So I'm just gonna open this up right now. So this is the powder vial, okay? The cap just pops off just like the Menopur. And then it comes with a preloaded syringe of water, and it literally says bacteriostatic water, okay? So I'm gonna take the cap off, and you can see that sometimes a drop comes out of the tip, and that's okay. So I want patients to take their time when they are reconstituting the powder, because this is like liquid crack almost. It's probably close to $900, and depending on which pharmacy you get it from, you just don't want to screw this up. You don't want to lose the water, and you want to make sure that you're getting your money's worth. So again, stabilize the vial. You're going to take the tip of the needle and make sure you go right down into the middle of the top of the syringe, and you're going to push the end of the syringe that contains the water all the way down. Okay? Once it's in, I like to just let go a little bit, because if you don't, sometimes you'll get a splash of liquid, and that's scary, because like I said, that's $9 a tiny little micro drop. There, see, now it's reconstituted. You're going to put that needle in the sharps container, and then you'll use the other needles that it came with in the tray. And here you can see that there are the numbers on the side. Take the cap off, and like I said before, stabilize the vial on a table. Push the tip of the needle in the middle of the syringe, turn it upside down, and then my tip here is when you're looking at the vial, make sure that you're looking at the division in the plastic base or top of the vial, and then turn the syringe so that the numbers are right in front of you, and then make sure you know the dose that your doctor wants you to take. You're going to pull it down to whatever that dose is and come out. So I teach mixed protocols, but I also teach patients how to mix their medications together. So if you're taking gonalf with Menopur, what I would teach my patients to do is, once they have drawn up their medication, either with the pen or the vial, they can then take the Menopur vial and mix the medication. So basically put the gonalf back in to the Menopur, and then use the syringe to draw it all up together, and then switch needles and inject. So we do one-on-one teaching in my office so that patients feel really comfortable with their medications before they leave. So the next shot is the Folliston pen. The Folliston pen is also FSH hormone, just like gonalf. You'll get this really cool carrying case. It kind of looks like the same color as my logo here. And when you open up your very expensive green or bluish carrying case, you're going to see a blue pen, okay? The blue pen is empty. Unlike the gonalf that's already loaded, there's no medication in here until you load it up. So what you'll do is you'll just take a look at that, and then you'll grab your cartridge. And just like the gonalf, just because the cartridge says 300 or 900, it has a little bit more medication. It has what we call overfill. So you're going to drop your cartridge into the top of the pen like that. You're then going to put your pen together. Okay, this also has a little window, and you're going to turn the knob toward yourself until you get to the prescribed dose. Let's say your prescribed dose is 150. The difference between Folliston and gonal, if you screwed up and you dialed to 175, you can't go back down. What you have to do is dial it all the way up and then push it in. dial it all the way up and push it in. And don't do any pushing on the end with a needle on top when you're using the follistim, because if the needle's on top, you'll just lose the medication. So just like the gonal, you have the needle right there. Don't put your finger there. You will bleed. I can't even tell you how many little holes I have in my fingers just from, you know, not paying attention. So 3 little screws. There are 2 protective caps on this too. Second protective cap. And then I'm going to get my sharps container, or I should get Wonder Woman pregnant right now. Here you go, Wonder Woman. There you go. Okay, Wonder Woman is now going to ovulate more than 1 egg this cycle. So then remove this when you're done. Okay, again, don't try and recap this. Just pop it into the sharps container, because if you try and recap it, you might put a hole in your finger. So what I want to show you now is how to get the overfill out of your follistim. So there's an equivalency factor when it comes to follistim and also gonalf. The equivalency factor is 9 IUs equals 75 IUs of medication. Got that? Yes. So let's say you have, you know, medication left in here and you just don't know how much left and you want to take advantage of it. All you do is you take your insulin syringe, that's the orange cap syringe that I showed you right here. You're going to put it just through the tip of the cartridge and you're just going to pull out from here. Follistim needs refrigeration, and so it's kind of hard to pull out the medication when it's really cold, so I would just wait until it gets to room temperature before you do that. So this is 9 IUs right here, and this would be equivalent to 75 of follistim. And then if you just keep adding, 18 is equivalent to 150, so on and so forth. So 9 times, very fertile carpet now, 9 times 4 is 36, so 36 units here equals 300 units of follistim. Okay, so that's a cool way of saving yourself some extra money and making sure that you don't overorder medication and don't contribute to the declining sperm counts of men, people. Don't throw these away into the garbage. That's what I tell people is, you know, it's also medical waste, like hormones, that ends up in our water system potentially that can be affecting guys' sperm counts. Or maybe it's just the pizza and beer. I don't know. Pizza and beer or this stuff. Okay, so now the next medication that I want to review is the cetratide. So cetratide is like relics. Okay, they're made just by made by different companies. So cetratide works to stop ovulation. So when you do an egg retrieval, you want to make sure that eggs are in the ovary and they have not left the building. It's really disappointing. I'd like to think that I can get an egg per follicle. Sometimes I can't. Very rarely a patient ovulates. And not every follicle has a healthy or viable egg. But we use medications like this and this to be sure to get eggs at the time of the egg retrieval. So I'll just open up the cetratide. And it comes in a little pack like this. And there's a lot of stuff inside. And you don't necessarily have to use everything. You can treat the cetratide once you're using the Menopur, just like an extra Menopur vial, and still use the Q cap. Or you can simply use all the syringes and needles that they give you inside here. So what they give you is a pre-filled syringe. You just take the cap off, and there's a spot right here for you to place the needle. Okay? Now this is the scary needle. This is where it's like, if you're afraid of needles, close your eyes now. Close. Paula's over there closing her eyes. Close your eyes. Okay? Scary needle, cap off. Nowhere near you. Not your tummy, not your butt. Don't do that. Especially not your butt. Okay? So now I'm going to push the water in. And then unlike the Menopur or the other medications that I'll show you in a second, cetratide doesn't quite clear up as quickly or look the same. It looks more milky. And if you're mixing it with your Menopur, just know that when you add the cetratide, your injection can sting a little bit more. So just do a little swirly swirly. And then I do the swirly swirly with the needle still in, right? So just like that. And then I'm going to turn it upside down and I'm going to find that little division in the gray part. I'm going to make sure that the needle tip is below the top of the water, and I'm going to withdraw all the fluid. Okay, and once I have all the fluid, Remember, lefty-loosey. Take off the needle. And then the injecting needle. The cetratide comes with a little bit longer needles than my patients use. It comes with a needle that is not quite a ½ inch. It's a 27 gauge 3/4 inch, so just a little bit longer. So I still prefer the ½ inch, so I ask my patients to use that needle instead of this longer one. So this goes in the skin of your tummy like the other shots that I showed you before. Okay, so next set of meds for us to talk about is the relics. I kind of showed you that already. And relics is a pre-filled syringe. Love the pre-filled syringes. It has this plastic covering. You just take it off. Medication is there, ready to go. The cost of each of these, a vial of relics, a vial of cetratide, about $100 to $128. You'll usually use 4 to 5 per cycle. My patients on average use about 5. So there's a cap on here, and it is not unusual. You can see there's a little drop of liquid right there. For there to be a drop of liquid, no big deal. There might be just a little bit air at the top of the syringe, and don't worry about pushing any of that out either. So just swab your skin of your tummy, go ahead and push the needle all the way in until the medication is in. Some patients ask me, should I put the whole needle in, half the needle in? Basically, the entire needle goes in until you can't see any of the needle anymore, and then you push the medication in and come out. You can also mix this and just push it into your Menopur vial. You might get an injection site reaction. That is not uncommon. Injection site reactions, I would say, occur maybe 5 to 10% of the time when you do the relics. Some tips I have for people are use an anti-itch or Benadryl cream. If it gets really bad and starts spreading, the way to notice if it's spreading is if you take a Sharpie or a permanent type pen and then draw a circle around it and then take pictures, and over time you can see if it's getting worse, and always call your doctor. My patients know that if something's going wrong, I want to be the first one to know about it. So Zyrtec during the day can alleviate, and literally within 20 minutes, any type of injection site reaction usually goes away. Okay, so Novarel, and it sounds really cool. Chorionic gonadotropin for injection. This is also known as the trigger shot. It sounds very violent, but I'm going to call it the love shot because that's what we're doing here, people. We're making babies, and babies bring love into everyone's life. I don't like the idea of a trigger. It just sounds very violent to me. So the Novarel also says something that seems quite scary to me. It says, for intramuscular use only. So when it comes to injections, you know, I'm teaching you a whole bunch of stuff, but when you look at the inserts, it's not necessarily going to tell you these little, you know, tidbits that I'm sharing with you. But same thing for medications like this. So just because it says for intramuscular use only, you don't need to just use it in your butt. The other place you use it is the skin of your tummy. So most fertility doctors do use it in the skin of the tummy, and the reason why we would use it in one place or another is basically physician dependent, but I would say 98% of my patients will still use this as a subcutaneous shot. When a drug company wants to get a different labeling, they have to spend a lot of money with the FDA to get that changed. So that's why this is still here. So inside here, and I'm just going to open it up. This costs about $120 some or so. What you'll see is a really big vial of water. My patients look at this and say, oh my goodness, what kind of shot is that going to be? And then they look at the powder and they say, holy smokes, what's going on here? And what I tell them is that don't even worry about it. It's 10,000 units, which just means that's the strength of the medication. And all you're going to use is 1 milliliter of water. And you're going to use the mixing syringe. Let me see if I have one here. Here is the mixing syringe. Actually, I'm not going to show you because once I open, it's going to be used. And like I said, it's 120 bucks. No, I'm going to save it. So you'll draw up 1 milliliter of water, transfer it to here, and once it gets here, it reconstitutes immediately. And then you draw it up, switch needles, and inject in the skin of your tummy. Okay, so that's the Novarel. Some clinics prefer Ovidril. Ovidril has a little bit less HCG in it. Other clinics use Pregnil. There's also just HCG, human chorionic gonadotropin. That's a generic form of Novarel. So all of those things work well. So now let's talk about estrogen, estradiol valerate. So estradiol valerate is an injectable form of estrogen. And when you open this vial, it's going to have a more yellowish color to it. So you can see here the color right there. And all you do is pop the vial off. You're going to refer to your doctor's instructions for the dose that you're going to use. And I use 1 milliliter syringes for this drug. And the reason why we use 1 milliliter syringes is when you're using a 3 milliliter syringe to drop 0.25 milliliters of a liquid, it's really hard to get the exact dose. So you'll add the needle to the top of the 1 milliliter syringe, just like that. Okay, take the cap off. It's a big needle. You're going to go right into your syringe. I'm sorry, into your vial. See? You got to be calm. You can't do that. Don't throw your syringe. Don't worry. I'm okay, everybody. I'm okay. I just want to make sure everyone's watching. I'll just pretend with this needle. Drop to 0.25. You're going to take it out. And for the estradiol valerate, depending on how big your tushy is, there are 2 sizes of needles. This is one size. This is a 25 gauge 1.5 inch, and the other side is a 25 gauge 1 inch. So depending on the size of your tush, this is where this medication goes. You're going to use either or. You've probably all heard about progesterone and how awful progesterone is. Everything that you heard is true. It is that awful. It can cause horrible reactions, and we'll spend a little bit more time talking about those horrible reactions. But the cool thing about the estrogen shot, it's usually every 3 days. Some doctors do it every 2 days. It just kind of depends on your story. And it doesn't cause a reaction the way that the progesterone shot does. And it's not as thick of an oil. It's compounded in ethyl oleate, so it goes in actually quite easily and nicely, unlike the progesterone that takes a little bit longer to go in. So I'm going to now set this aside. And the next thing that we're going to talk about is lovenox. So let me show you lovenox. So lovenox is something that I do for people who, let's say, have recurrent pregnancy loss issues, history of miscarriage, their husbands have an HLA gene that would make it so that lovenox should be used in their treatment. There are a number of reasons. Other reasons would be like a factor V Leiden, heterozygosity, prothrombin gene mutation. So depending on your situation and your doctor's preference, they might actually prescribe something like lovenox. So lovenox looks really benign, and it looks benign because it's this really pretty syringe. It has a lovely cap on top, and the medication's loaded, ready to go. But it can be evil. It stings like heck. And so what I tell people to do is, unlike the other shots where you pinch, can you see my tummy on there? I just want to make sure you can see my tummy. I'm not showing you my tummy. Can you see? Can you see me?
Kind of.
No? Should I stand up? I'm going to stand up. No? How about now? Can you see my tummy? Okay, cool. So rather than going below, okay, rather than going below your belly button, for the lovenox, I ask people to actually go on the sides. And rather than pinching the skin for the lovenox, pinching, flatten your skin out. And then try and pay attention, you know, just like I have blood vessels in my hand, you can see them running through the top of my hand. We have blood vessels also in the skin of our abdomen as well. So what you want to do is really avoid a blood vessel. You don't want to create a smiley face of bruises as you're doing the lovenox, okay? So stretch the skin, go in straight with the needle, and unlike the other shots, you can actually go really, really quickly with the lovenox. I want you to go really, 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 really slowly, then come out with the needle and don't rub. So the key to not having a reaction with lovenox is no rubbing. Don't rub the area of the shot right after you gave it to yourself. Because if you rub, you're going to get a big, fat, honking bruise, and I don't want that to happen. So Lupron comes, and I just labeled a vial, and I just called it Lupron. But Lupron basically looks like this. It's a multidose vial, and it's really, really expensive. What I mean by multidose is that you would go into the vial many times during your cycle, depending on your protocol. So if it's a long Lupron protocol, you'll start up by drawing up 10 units. I think my needle needs Viagra. That's funny. Okay, so you start up by drawing 10 units about a week before your stim starts. Okay, so you just go like this, turn it upside down, pull to 10. It's a tiny amount of fluid, and then you inject it into the skin of your tummy. Side effects of the Lupron, you know, I would say I've had some patients experience, you know, feeling a little tired on it. I've had the rare situation of having high blood pressure on it. But for the most part, you know, all you have to deal with is just the pain in your tummy from doing a shot. But otherwise, the side effects that people are worried about when they look up Lupron online are really the side effects for a medication called Depo-Lupron. So Depo-Lupron we use in endometriosis. It shuts down the body. It causes a medical form of menopause, and that's scary because no one wants to do that. You just want to get pregnant. But we use Lupron to prevent ovulation, just like the cetratide and ginn relics. So HGH, and that is a drug that I offer to all my patients over 40. Any patient under 40 with a high FSH or a previous IVF cycle that didn't work or a fertility gene from their genetic profile that makes me think that they might not have as many genetically normal eggs than I would expect for a woman at their age. Okay, so the way Omnitrope, and that's the one that I use, and everyone has their own style, but there are different brands of HGH. So it comes with a powder vial and a water vial, and all you do is you take all the water. So one of the mistakes that people make when they reconstitute the Omnitrope is that they use water that doesn't go with it. They use the water that comes with the Menopur. So if you do that, you're not getting the right strength of medication out of your HGH. The other thing people do is after they reconstitute it, they use the whole thing and then they throw it away because they think it's a single-use only vial, just like Menopur, but it's not. So after you take all the diluent and put it into the powder, you're then going to use the orange cap syringes, and this is the type of syringe you use to mix it. You're going to use the orange cap syringe to draw up to whatever dose your doctor tells you. So most of my patients do around 25 to 50 units, and the timing and the frequency I base on a patient's body size and their age. Okay? So are we having fun yet? See, it's not so bad. It's really not so bad. There's something called the buzzy bee. If you don't know what that is, I would suggest looking it up. It's this really cute thing. It literally does exactly what I just said. It buzzes and it looks like a bee, and it has like a gel cap in it, and you can just put it on your skin before a shot, and it vibrates for when you put the shot in so that you have no pain, you're totally distracted, and it's very, very easy to do. So they're really, when it comes to doing treatment and doing IVF, what I tell people, whatever your phobia is, I can work with it. Whether it's you're scared of needles, you're scared of blood draws, there's always something that we can do to work around your situation. I have patients that have what I call pelvic anxiety. They don't want pelvic ultrasounds. Well, I do everything abdominally. They come into the office with a full bladder. So don't let a fear of needles prevent you from seeking fertility care. Okay, there's always a doctor out there. Like me, most of us, love helping people and want to make sure that we're working around you and what you're comfortable with. Okay, so the next medication and last one I'm going to talk about is the progesterone shot. Where is my fancy little teaching kit on the progesterone shot that I had all set up? Well, I don't see it, and that's okay. So I'm just going to pretend, oh, here it is. So these are the two needles. So I showed you the 1.5 gauge needle, and this is the 1-inch needle. So depending on the size of your tushy, you're going to use the needle that your doctor thinks is right for you. So I would say if you're a size, just to talk in like lady pant sizes, if you're a size 10 and up, potentially the 1.5 gauge needle would be good for you. If you're a size 8 and smaller, maybe the 1-inch. But I literally go to my patients, I say, let me see your butt, and then with gloves on, I'm going to do a little squeeze and see with your husband present and a Sharpie in my hand, or your girlfriend, mother, sister, anyone, wife, and circle on your butt and make sure we're going in the right spot. I'll teach you how to do it. My staff member will teach you how to do it. Make sure you understand how to do it. So as far as the progesterone and oil, some tips. One tip is warm it up before you do the shot. So maybe put it in your bosom, give it a little love for maybe 15, 20 minutes before you do the shot. Make sure I can find it now. Take it out. Now that it's nice and warm, okay, it'll be a little bit easier to draw up. I'm going to grab some water here, and let me just show you how to draw it up. I have so many needles here. I want to make sure, oh, I dropped the needle. Remember? I dropped the one that I was going to use for this one. So when you draw up the progesterone and oil, it can go really, really slow. This is going to go fast just because it's actually not the oil. Okay, so the dose that I give my patients is 1 ml. And the reason why I give them 1 ml is I usually get the progesterone, and it depends on the patient's insurance. If their insurance isn't covered with the pharmacy that I use, and you know, they have the option of paying out of pocket or using a different pharmacy. But I really like to use progesterone and ethyl oleate, and it's 100 milligrams per ml, and it's 1 ml per shot. Okay, that's the dosing I give. Just because I do it doesn't mean that your doctor does it. There's so many ways of baking a cookie, and in the end, the cookie's going to be darn good because cookies are awesome. So once you're at the 1 ml, some of my patients like to prepare their buttocks by icing it first. So you can use a gel pack, you can get these little tiny cute little ice packs, wrap it in a paper towel and just put it on your butt for 5-10 minutes before you do the shot. And then once you do the shot, after the needle comes out, a little massage. And when I say a little massage, you can do it either with a high density foam roller, you can do it with a hand massager, you can do it yourself, you can have a partner do it or someone else do it for you. And a nice massage for 10 to 15 minutes so you don't get the 4 butts that some people get, so you don't get the big lumps, so you don't get a rash. All of that can help. And you can do the heat while you're massaging or massage first and then use a heating pad. And doing that will hopefully help prevent you from getting a really nasty injection site reaction. And nasty injection site reactions can be a rash, and that rash can spread. The rash can spread all over your body. It can cause itching. So if at any time that starts, notify your doctor immediately. And some of the things that I've seen with patients is the rash starting even a week after they've stopped the medication, or having knots that are there months to follow, or even having some numbness down the legs. So those are the things that are happening to you. That might be a perfect situation for either switching to a different oil, switching to a different size needle, or considering vaginal endometrin, or I should say vaginal progesterone. It's like Vagiseltzer, Alka-Seltzer in your vagina. You place the tablet in the vagina with the applicator and it gets absorbed. The only problem is you'll get a runny discharge, but that's a heck of a lot better than feeling itchy on your butt all day long or having a rash like that. I was going to show you and do a shot myself of the progesterone shot. Can I? Can I do my own shot? If I stand up, my head's going to be cut off. You'll see my butt. Okay? Can I do that? Here, I'm going to do it like this. No, I want to do it. Let me see. If I twist like that, I'm going to show you my butt. Yeah. Okay, here. Let's see. So where's my alcohol? So I just want to show you that you can do your own progesterone shots. So I'm going to go like this. I'm just going to pull down my pants just a little bit, and I'm just going to go right here. Don't look at my tattoo. Just kidding. I don't have one. My mother's probably watching. Okay, so I'm going to just feel around here, and I'm just going to line it up. 1, 2, 3. Oh my God, that really hurts. That hurts going in. I kind of wish I had ice. So I'm going to push. Actually, I'm going to withdraw, touch, make sure there's no blood. There's no blood. I'm going to push, and then I'm going to come out, and that's it. Okay? And I'm going to just do a little rubby, 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 rubby. Ow. I would say that that's the first time I've ever done that. And that hurt. So ice it, people, ice it. Ice 5-10 minutes before you do the shot, and then use a heating pad afterward. But I'm actually quite surprised at how much that hurt going in. So for all my patients who are doing these shots, that's who you are to me, okay? You really are. Because to do that for almost 10 weeks of pregnancy, that's a really long time. Okay, so a great blog that I refer my patients to is called IVF is Very Fun. And I mean, I try to make it fun. It's not always fun because you have good days and you have bad days. You have some patients that get pregnant and have a normal embryo, and other days where patients don't or have miscarriages. So we try and make it as fun as possible, and this is a great blog that kind of takes you through the process from start to finish. So if you're out there and you don't have a fertility doctor to turn to, you can always turn to eggwhisperer.com. We'll get your levels checked, we can talk on the phone, we can coordinate care from anywhere and find you a local fertility doctor to take care of you. You can go to eggwhisperer.com/show and see details on how to contact us for the show. Call in live with your questions every Wednesday night. So please ask more questions. I'm going to go onto my computer right now. I had an email question. I'll start with that. I'm just going to bring my computer up. There. Okay. So let me, oh, my computer logged out. So let me just log back into it. And then while I'm doing that, Paula, do you have any Facebook questions for me?
Doesn't look like there's a lot of chatter. They're worried about Wonder Woman.
They're worried about Wonder Woman. Probably my butt. Isn't anyone worried about my butt?
No one's mentioned your own bottom.
That's okay.
But yes, there were some good jokes around the fertility of now Wonder Woman. And that she is no wuss was one of the great comments.
While I'm logging in, I'll show you what my tabletop really is. For those of you who didn't watch a previous show, the tabletop is actually an egg whisperer cornhole.
Oh, yes.
And we have, let's see if Paula can get the hole.
Oh,
no.
Bummer.
What about, okay, here we go.
Ran right into the cervix there.
That's okay.
Oh,
almost. So I have my little bean bags that are sperm. Very fun. Okay. So the question that I had emailed to me, and she would like me to ask the question on the show tonight. The question is, hi, my name is, I'm going to say Paula, and I live in California. I've been trying to conceive for 6 months after a miscarriage, in which I hemorrhaged so bad that I almost lost my life. I'm now on my 4th round of letrozole, and I'm desperate to find out why I'm not achieving a pregnancy. Money, of course, is a huge aspect in my fertility care, but I also can't bear to go through more months of no hope. Is there anyone in my area you would recommend as far as a reproductive endocrinologist? I live 5 hours from any fertility doctor, and I'm just trying to find out what my options are. Any help is so much appreciated. So that's why I started the Egg Whisperer Show, because I know there's so many people out there that don't have a local fertility expert, that don't have someone to turn to, and anyone who's gone through that, I want them to be successful. It doesn't matter where you live. So what I would tell Paula, it's not really you, Paula, I should have used a different name, in this kind of situation is to get your fertility levels checked, check the sperm, and then your local OBGYN can do a workup to see what's going on with your fertility. It takes 3 things to have a baby: egg, sperm, and fallopian tubes that are open. Even though someone got pregnant in their uterus, it just implies that at that point in time, 1 fallopian tube, at least 1, was open. So if someone's having a harder time getting pregnant, it still makes sense to check the fallopian tubes. And most large hospitals, even community hospitals, can do hysterosalpingograms to assess someone's fallopian tubes. And letrozole is a fertility pill. And the woman who emailed us shared with us that she's now on her 4th round of letrozole. Most people, if they haven't gotten pregnant within about 3 to 4 cycles of letrozole, the chance of getting pregnant in cycles 4, 5, and 6 go down. So that's the point in time where seeking care from a fertility specialist and starting to think outside the box or just outside your local area, if you live far from someone, is a good idea. So there are docs like me who offer telemedicine consults that can take care of you remotely and then get you set up with a local doctor who would potentially work toward the same goal on a plan together to help you. So thanks for emailing that question.
And we do have a Facebook question.
Great.
Since certain oils cause inflammatory reaction, what is the best type of progesterone for someone with or prone to endometriosis?
Got it. So when it comes to endometriosis, I wouldn't say that there's a certain progesterone that might be better or worse. I don't know that sesame seed oil or cottonseed oil or ethyl oleate or that's really been studied, but I do like ethyl oleate because it's the most hypoallergenic compared to the reactions that I see in others. But I've certainly seen bad reactions even with patients who've used ethyl oleate in the past. So that's a great question. I don't think that there's one oil that's better than another for patients who have endometriosis. Let's see, any other questions?
No, we do have someone who's called in, if you would
Okay.
like to take them.
Let's take the caller.
Whitney is displaying here.
Okay.
1 second, we'll bring you on.
Okay.
Hey, welcome. Welcome to the show.
Hi, my name is Whitney.
Hi, Whitney. Thanks for
I live
calling.
I'm in Madison, Wisconsin,
Awesome.
and my question is, thanks for first off for talking about all the shots. They can be a little bit overwhelming, but like with the trigger shot, is there another place that you can administer that shot besides the butt, or is that the only place you can do it? And
Yeah, I mean, I think that that's a really good question. I have patients that ask me all the time, like I've given them their instructions, I've emailed them, I've talked to them about it, and then they call me and they say, well, it says for intramuscular use only, and you're telling me to use it in the skin of my tummy. And would I reassure them that it's perfectly okay to take it in the skin of the tummy. It can be just like the other subcutaneous injections that you give yourself during your cycle. It doesn't need to go in the buttock. But great question. Thanks,
Okay.
Whitney. And best of luck.
And is there any other tips for how not to make the progesterone shot burn?
Yeah, I mean, I think making sure you're doing it in the right spot. So if you're doing it too low in the buttock, it can actually collect there and create these huge lumps. And so patients who don't do it high enough sometimes get a really bad reaction. And you'll know if you got a bad reaction because the next morning you'll wake up, it'll be red, it'll be inflamed, but sometimes even if you do it in the right spot, it can still be red and inflamed. So if it is red and inflamed and that does not go down, notify your doctor because you may not be a candidate of continuing on the progesterone injections and should strongly consider doing endometrin. And there's so many ways of getting progesterone in your body. You know, for patients who can't tolerate the progesterone shots, I had them do endometrin 3 times a day, sometimes even 4 times a day with oral progesterone called Prometrium, 1 time a day, 2 times a day, titrating the level, titrating the amount of medication they take based on their level of progesterone in their blood. And we check those levels so that we can know that patients are getting enough. Great question. Thanks, Whitney. Do you have any other questions tonight?
No, thank you.
Awesome. Thank you. Well, thank you again for watching tonight's Egg Whisperer show on fertility shots. We'll be here next week talking about how to prepare for your embryo transfer. You can watch us live. You can watch us on eggwhisperer.com/show. We're also now on iTunes. Have a great night. See you soon.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Aimee.
She's known as the Egg Whisperer.